What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. What's up, everybody? We are getting on here with one of my absolute favorite topics, and I say that somewhat seriously, somewhat sarcastically as well, but we're going to be talking about work-life balance. And I will always preface this conversation and say that I am aware enough to know that I'm on the end of a spectrum. I'm sure some of you that know me know which end of the spectrum that would be. And Zach and I are just going to kind of share our thoughts today a little bit on some just general considerations, some things that we've noticed over the years, things that work well for us, and just kind of how we view this general progression of what maybe is communicated as balance, but maybe you recognize a little bit becomes a little bit more of this rhythm or tempo to your life, in that it can change drastically at times through various things that happen. It can change as a result of intentionality, as a result of the unexpected, as a result of time. But overall, a very, very important topic that hopefully our over 20 years of doing this after PT school between the two of us can just offer you up some gems. So, Zach, I'm thinking back to you early in your career, and you had just graduated, and you're working at a PT place. What are some things that you're noticing about your schedule? What are some things that you are also potentially taking on outside of your quote-unquote 9 to 5 that are playing into your ability or inability at that time to kind of handle work-life balance as a new grad?
Yeah, and to frame this up, to give some people background, when I graduated from PT school, my wife and I had just gotten married, so had a spouse. We did not have kids in those first couple years. But that was kind of on the way, and we knew that was right around the corner. And I was working 40 hours a week as a staff PT at a outpatient orthopedic physical therapy office in the Frederick area. But in addition to that, I was doing some strength conditioning as kind of a side hustle. So I'd started an LLC, and I was working with both individuals and small groups, kind of going from place to place, doing strength conditioning, speed and agility work. And that was with the intention of making a little bit extra money, but also just to see kind of where that took my career. And was that something that I would venture off and do on my own? Or would it just kind of stay as a fun side hustle to help pay off loans a little bit quicker and have a little bit extra spending money? It's funny, though, that you talked about, balance, rhythm, tempo. I really like that rhythm and tempo kinds of words, because I look back at the early stages of my career, and outside of my quote unquote 9 to 5 PT job, every other role and responsibility I had was self-inflicted. Like, I was choosing to do those things, but I routinely would leave my first job with probably over half of my notes not written. And I had no other role at work.
Love the honesty.
Yeah, it is. It's funny because I had no other job than to just show up and treat patients. Yeah. Like, I didn't have any leadership roles. I didn't have any administrative roles. But I was routinely somebody. And to allude, what I mean by that is when I was in the clinic, I felt guilty writing notes when I was working with patients. So I would spend my time, giving all of my attention to the patient, which in reality, while I'm like watching them do their 7th, 8th, 9th rep of something that I've seen them do competently already. So do they really need that eagle eye on them during that time? But I had the mindset of like, oh, I'll just do these at home. And I was getting stressed out. I was getting burned out because I was spending so much time at home, waking up early before work or doing in the evening or trying to carve time out on the weekends to write notes. And I remember one of the PTs I worked with there, she would just laugh at me because Friday would roll around. She'd have everything done. And she's like, Zach, you're going to hit a point where either your wife or your kids or some other obligation is not going to be thrilled that you're spending time writing notes. Like, just get them done. It's not that hard to do them throughout the day. And I only bring this up because now, 11 years later into my career, patient care is one of like the 3 or 4 different hats within this company that I wear. and I routinely leave the office every day with my notes done. And it's funny, I function better from a balance and a tempo and a rhythm standpoint the busier that I am. So like for me, the more roles and responsibilities I have that I enjoy doing, I better chunk and allocate my time, and I'm way more efficient than if I'm only doing one thing and I can kind of, skate by or coast by and do things as desired. So no, it's funny. I think that balanced tempo, different parts of your life, you have different rhythms that you go through. But I am actually more efficient and better balanced when I have more clearly defined roles and responsibilities and I can self-organize.
I'm going to take this a slightly different direction and take it just back to, honestly, pre-PT school even for me, and I think something you can probably relate to, but playing multiple sports as a young person always put me in a situation where I was having to juggle and create time. I think far too often I hear people say that they don't feel like they have enough time or that they're limited on time. I largely think in a lot of those situations it's a matter of creating time. And when you have your job as a young person, which is school, it's first and foremost for anybody, and I say this being in a situation where I took a sport as far as I could possibly take it, being the sport of lacrosse, it ends. And it ends for everybody, even in the big four sports. It ends at some point in your life, and your skills that you've acquired are the things that still carry with you. But during those younger years, it was school, home, homework, sports, potentially finish up some homework some more, or some social. So I think you could relate to that, given the fact that I know we were both three-sport athletes, and you're creating time in your life to juggle everything, sport, school, and social. And I think that prepares a person as they go into college, as they go into grad school, to potentially handle more than just 9 to 5. And I look back at other things that I put on my plate, and hopefully I'll get a couple chuckles here, but I did the paper route when I was in middle school. I was a lifeguard and did swim lessons in high school. In college, I was doing private lessons, small group lessons, and I had a pretty sizable camp, which actually led to me creating my first company, which was called Lax Factory. And that actually started the year that I graduated from PT school. So my first business actually wasn't Rehab to Perform, but I was creating time to do things that I liked and or thought were generally productive for me moving forward. I was doing, I didn't have my own LLC for personal training or small group training, but I was doing that elsewhere over at a place over here called Sarge Athletics to round out my skill set so that I could be better in the sports rehab arena. But I was taking on more things, again, self-inflicted, to put myself in a situation where I thought that it was creating a better future for me, whether or not that was business or skill-based. But to be quite honest, I don't even know when I started to hear the phrase work-life balance. I don't really think it was as much of a thing, at least to my knowledge growing up. And I think it overall, and yes, we're, your middle 30s. I'll date myself and say that I'm very, very close to late 30s. I'm like in between the definition there. But we're kind of this old guard, and things have changed a lot in a decade, and we're dealing with different circumstances for young people. And it's just interesting to hear the topic so prominently, especially in situations where we do have young people that are either choosing to take on more, or it's just challenging for them to just do the 9 to 5 and transition outside of PT school to what many would say is a bare minimum in terms of entering the workplace. So, Zach, I don't know if you have any thoughts on that, but we have a lot of conversations internally. We track work-life balance now for 4 years that our team communicates on a scale of 1 to 10 at the end of every year. What are some things that you've noticed through conversations, largely in your role as a mentor to some of the younger clinicians in our ecosystem.
Yeah, and I think kind of like two things to touch on there. And one thing that I really love that you had brought up previously was exposure to a variety of jobs and a variety of different working experiences. And I had a very similar kind of childhood background as well, where I worked at a grocery store pushing carts. I worked as a lifeguard 40 hours a week. I worked on a farm in the morning prior to lifeguarding 40 hours a week. And you had always talked about having, working in retail or working as a waitress or a waiter or a hostess or a bartender or a barback, and getting exposure to dealing with people. But also, I think we need the different concepts of like what work is and when is something done. And that was something where every summer in high school and college, I worked two drastically different jobs. One is a lifeguard, where I showed up, I clocked in at this time, and I clocked out. And kind of whatever happened in between, it was you spent some time in the chair, you did some other tasks, but it was largely a job of like, you go in at this time and you leave. And then you just show up the next day and you do it again. Whereas when I would do the other stuff in the morning at the farm, it was, this is the work that gets done, and you can leave when it's done. And that was a drastically different experience, because it's, all right, you want to move slow, that's fine, you're just going to be here longer, and you're going to get paid the same amount. If you get it done quick, you can get out of here and you still get the same amount. So I think having those exposures, like you had talked about, working in different environments and learning to work with people is extremely important, but also having exposure to different jobs and different responsibilities, where some are time-based, service-based jobs, and others are almost like a fee-for-schedule type job. Like, this is what you need to get done. It's up to you to get it done. I think that breeds two different types of mentalities. Things that I find myself having conversations with our current staff members and previous staff members are really just listening to what they find themselves struggling with, or not even struggling with, but trying to manage from a work-life balance. I think a lot of it comes down to really just figuring out, like, what do you value? And I think some of it's coming down to, at different points in their life, and a lot of times you went to high school, you went to undergrad, you went to PT school, now you're in the working world, and it's your first exposure to what being a full-time, career-oriented person as opposed to a full-time student looks like. Oftentimes, people are trying to figure out, is it necessarily work-life balance, or is it just, how do I enjoy spending time, and what am I doing outside of the office? You had mentioned you have, things change in regards to your athletic career comes to an end at some point. Our interests change throughout our life as well. And there's stuff that I spend time now that I enjoy doing that I never even thought about doing 10 or 15 years ago. There's things 10 or 15 years ago that I spent a lot of time doing from an athletic and sports standpoint that I no longer have to spend time doing that. So I think a lot of times that word of balance comes back to really just sitting back and figuring out, like, when I'm outside of work, how am I spending my time? And is it bringing me joy? Is it bringing me happiness? Is it engagement? Or am I just kind of still going through the motions of something I used to always do because that was all that I know, and I haven't adjusted to this new role? So I think a lot of times just prioritizing, how are you spending time in the clinic and out of the clinic? We had another episode where we talked about how do you make your time in the clinic more enjoyable in regards to getting involved in things that kind of fill your cup there as well.
Yeah, and I think I almost think of the word seasonality. Some of the things that you reference, especially during the summertime, and I can relate. I had a serving job for a small block of time while I was going through clinical rotations in Dewey Beach, Delaware, for anybody who's an Eastern Shore goer, in the Maryland, Delaware, Pennsylvania, or New Jersey area. I also had a summer working for a moving company. Now, was I ever walking into any of these situations and thinking that they were going to have any kind of staying power? No. I walked in largely thinking, hey, I'm going to make some money to put myself in a position where I either have extra spending money or I'm not having to take as many loans on, and also I should learn things in these environments. And then when it comes to post-DPT school graduation, why would I be a personal trainer or a small group trainer? Well, there's skills that are acquired in addition to the fact that I knew that I would be able to pick up things that had a little bit of ebb and flow. In those kind of environments, summer is a huge time period. You're going to naturally be more busy because college athletes are home. And then fall, things are going to kind of calm themselves down. So these waves of life where you can kind of ride the ups and then ride the downs, I think allow some of these work-life balance. If you look at work-life balance a little bit as an enlarging water balloon. Sometimes the water balloon expands a little bit, and ideally it kind of reduces in size a little bit. So the more that we can microdose, push our capacity a little bit more, I think largely prior to graduating and entering the workforce puts us in a situation where we are able to handle more. And then I think the most important thing, and you are a perfect representation of this, I automatically think of you and Matt every single time because I'm like, how do these people do what they do for a company, do what they do in the community, and then still are incredibly active and involved husbands and parents? So I think these preparatory steps, and for anybody who's younger, who's, potentially in school currently, you should think about microdosing, expanding your water balloon a little bit, allowing it to reduce in size, figure out how you handled it, and then put yourself in a situation where you're kind of figuring out what your resting level is, knowing that 10 times out of 10, your ability to do a little bit more is going to be a difference maker in your career. Zach, I don't know if you have any thoughts about that or if any of that were things that you were considering, but I largely think at this point I can say for my career, I've been a result of microdosing experiences, microdosing these different situations that have kind of all come together. But if I had just been doing the bare minimum, just school as a child, just school when I'm in DPT school, just my job when I'm a young professional, I can safely say there is not a chance in hell that I would be where I am today.
Yeah, and I think touching on that concept of microdosing, the biggest thing that I get from all of that is everything is interlinked. And each interaction you have throughout your day, throughout your week, throughout your month is going to influence another one. And speaking personally, like a realization for me is trying to juggle work responsibilities, family responsibilities, and then also just, personal things like, I've always been an active person, so doing something physically active on a day-to-day basis is important to me. That's an adjustment throughout my career where I've had to modify what that looks like. I was always an end-of-the-day evening workout person prior to having kids. That does not work very well when your kids have practices. And I went through a period of time where, I'd wake up in the morning, shower, eat breakfast, go to work, and then I would come back from work, and my evenings always felt so chaotic because I was trying to squeeze a workout in, which usually was unproductive because I was, kind of at the end of the day a little bit tired from doing stuff at work. So then, I was pissed off because I had a bad workout. Then the whole time working out, I'm trying to figure out, well, how do I get my kid to practice? Or I need to call Britt and figure out what we're doing to get this right here, or who's going to handle bedtime routine or dinner. And then that led to just even more kind of stress and chaos. And then it was just this never-ending thing. So then the simple thing is, all right, well, maybe we shift workouts to morning time. And now we knock that out of the way. It's done. I don't have to think about it. I'm setting myself up for a more productive day at work because I'm somebody who I think a little bit clearer, and I'm just in a better overall kind of affect after I've done something active. So that makes your workday that much more enjoyable. Then when I get home, work is done, workout is done, now it's family time. And you've kind of chunked these things into different periods of your day, which it took me time to figure that out. And it took me some experimenting, and that's something that I do recommend with our new hires, whether they're a new grad or not, when they join our company and they're acclimating to either maybe a new geographic location, just a new company and an organization in general, is I'll tell them, use your first 3 months here to experiment with different rhythms during the day, during the week, and find what works best with you. Are you somebody who likes to have different days with different themes where you kind of pick all the different things that you like to do and you do them on different days? Do you like to microdose them throughout the week? Figure out what works for you and what works best on your current situation, because what you were doing at your old job in California may not work now when you have more of a commute or less of a commute or different roles and responsibilities. or access to gyms or parks or other things, nightlife, downtown stuff, it just isn't the same as your old situation. So I think just always reflecting and figuring out is what I'm currently doing matching up with, one, what I want to be doing and is logistically feasible and realistic given my situation. If it's not, can we modify it? Cool. If we can't modify it, well, then how do we make the best of it or find something else to get involved in?
Yeah, and I think the experimentation part is so key because at the end of the day, you graduate and it is very, very new. You're most likely earning your first 40-hour paycheck. You have your first 40-hour job at a minimum. You're in a situation where potentially you're paying your own bills fully for the first time in your life. And what does this relate to? This relates to the fact that we have 4 years of historical data to suggest that our youngest clinicians always have the lowest work-life balance, self-reporting scores, and that over the course of the time period in which they're working with us, it gets better. And it's not a comparison, but it's always interesting to have a younger professional that seemingly has so much less on their plate, especially when it comes to family responsibilities, and kids have to be the biggest thing that throw curveballs into your life at any given moment. And you have individuals who have been through their career for an extended period of time and have much higher self-reported scores. And I do think that largely relates to experimentation, a certain amount of expectation that individuals are putting on themselves that sometimes can be very, very counterproductive, and an overall, maybe at that point in time, lack of the word routine, where they just have not figured out a routine that best fits with them. They have just not had enough time. So for any young professionals who are listening to this, I am by no means dismissing the feelings that you are having, but you have to be able to sit back sometimes and listen to yourself and start to ask why, because your life will probably only most likely have additional layers of complexity, especially when you put yourself in a situation where you want to take on additional roles, whether or not that's professionally or personally in your life. And it is up to you to experiment, to tweak, to reach out to mentors, to find resources, to largely put yourself in a situation where you shouldn't be sitting here 5 years into a career and saying you have work-life balance issues. If you've largely been pointing the finger externally and you're not pointing it at yourself somewhat, I would argue that you could find yourself in a situation where you find a new job and guess what? The same problems continue to happen. One of our biggest things at R2P from an operating principle standpoint, solutions first. And how do you find solutions first? You put your thumb towards your chest and you address it with self first. Zach, any parting notes that you want to share for the young professionals, especially out there, as this is a absolute buzz phrase, and I don't think it's going away anytime soon?
I think just understanding that everything we're talking about and everything that we're providing quote-unquote advice or information or just sharing our experiences on is stuff that we went through and stuff that people before us went through and stuff that individuals after us are going to go through as well. So when you are looking at work-life balance, it is a two-way street. Part of it is how are you managing your life and how are you managing things internally and making sure that you're putting yourself in a position for success. The other part of that is the work part. And make sure that you're not committing to a place to work that just doesn't match up with something you're interested in doing. And part of this goes down to doing your due diligence on companies and making sure that you are well informed of the situation you're getting yourself into. And what I say that is you're not looking for the perfect job because the perfect job doesn't exist. There's always going to be a give and take no matter what your situation is, whether you're self-employed or you work for a company, whatever your role is. So just make sure that you are well informed of what your expectations are. And I think being well informed of what those expectations are allows you to then better organize yourself and what you are doing externally to match up with what your demands are from a job standpoint. And then the second part of that is don't be afraid to talk and ask questions. And I think something that we try to pride ourselves on here is being extremely open and receptive to feedback. And if people have concerns or if people have questions about why something is done the way that it is or what certain different initiatives are, we try to be very open and transparent as to why we do things. And if there is something that is a little bit challenging, we figure out like, all right, well, is this just something that we haven't attempted to modify or change or find a solution for? Or is this the best available option that we have? And we need to make sure we're finding a way to make the most of that. So, make sure you're finding a job that matches up with your expectations. Make sure that you're looking at yourself internally and figuring out, is there anything that you can do to help the situation? And then finally, don't be afraid to recognize shortcomings and being open to feedback and being open to change.
Zach, I think that's some really, really good parting advice. And for anybody out there who still has questions, Zach and I are very approachable. Reach out to Zach on Instagram at ZDBaker30 and myself at drjoshfunk on Instagram and TikTok. Yes, you heard it right, TikTok. But if you want to hear us talk about a topic that is near and dear to your heart, or you're just curious about our particular thoughts, don't hesitate to reach out about anything and everything related to physical therapy and the healthcare community at large. As always, thanks for listening. Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.